Today, my topic is the study of eosinopenia as a diagnostic and prognostic marker in COVID-19 infection, category respiratory diseases. Introduction. The COVID-19 infection has spread rapidly worldwide since its outbreak in December 2019. COVID-19 may present with varying degrees of disease severity from asymptomatic to upper respiratory tract illness or mild multiple organ dysfunction. Diagnosis of COVID-19 requires clinical suspicion and knowledge of its clinical characteristics, along with its typical radiological abnormalities in CT chest and its laboratory confirmation with RT-PCR technique. Thus, it is important for the physicians in your clinic to efficiently triage suspected COVID-19 patients. Routine blood investigations we generally do for a suspected COVID-19 infection include CBC, RFT, liver function test, electrolytes, CRP, LDH, ferritin, coagulation profile. Among them, CBC is the most efficient and economic investigation. Various studies showed that patients with COVID-19 infection tended to have higher neutrophil to lymphocyte ratio in CBC. Some studies even showed that lymphopenia and eosinopenia correlates with elevated CRP levels and hence facilitates the prediction of triage and prognosis of COVID-19 patients. The main objective of my study is to investigate the diagnostic and prognostic value of eosinopenia in COVID-19 RT-PCR positive patients and to correlate eosinopenia with lymphopenia, CRP levels, and CT severity score in COVID-19 RT-PCR patients. The methods. Eosinophils, lymphocytes, and neutrophil counts were from routine CBC and CRP levels were collected from 1 or 2 COVID-19 RT-PCR positive cases admitted in the NRI Institute of Medical Sciences, Vishakhapatnam. CT test was done in 84 cases and CT severity score was calculated. Furthermore, eosinophil counts were reviewed at the time of discharge or after 1 week of admission if patients remain in hospital. Percentage of patients with eosinopenia on admission and at the time of discharge and correlation of eosinopenia with lymphopenia, CRP levels, and CT severity score was studied in this study. Results. The patient considered for this study are 1 or 2 patients. Out of 1 or 2 patients, 40 patients, that is 39% patients were admitted in the ICU, and rest 62 patients, that is 61% were admitted to the ward. In CBC done on admission, 76 patients had 0 eosinophils, 16 patients had 1% eosinophils, and remaining 10 patients had more than 1% eosinophils. Is the graph showing the number of patients who are 76 having 0 eosinophils and 10% patients having 1% is more than 1% eosinophils and 16 patients having 1% eosinophils. Among the ICU 1 or 2 patients, 40 patients were admitted in the ICU. Among them, 38 patients have 0 eosinophils on admission. In ward patients, out of 1 or 2 patients, 62 patients were admitted in the ward, and 38 patients had 0 eosinophils, and rest of 24 patients had normal CBC and admission. Among this 0 eosinophil group, that is 76 patients who are having 0 eosinophils, even them also 54 patients had associated lymphopenia. And coming to CRP levels and admission of patients, mean C-reactive protein level and admission among patients with 0 eosinophil was 69.63 milligram per deciliter, whereas it was 24.42 milligram per deciliter in normal eosinophil patients. There is p-value of 0.007. Coming to CT severity score among eosinopenic group was 13.71, whereas it was 8.38 in normal eosinophil patients. Coming to the CBC complete blood count done on the discharge or after 1 week of the admission, 42 patients remained eosinopenic and remaining 60 patients had normal eosinophils. This is the graph showing the patients on discharge. 42 patients remained eosinopenic and remaining 60 patients had normal eosinophil count. It shows that 34 patients who were eosinopenic on admission remained had eosinophils in CBC after 1 week. Remaining people remained eosinopenic only. Out of total people, 34 patients who were eosinopenic on admission had eosinophils in CBC after 1 week. Coming to discussion part, the pathophysiology for eosinopenia in COVID-19 remains likely multifactorial, involving inhibition of production and release of eosinophil from the bone marrow, reduced expression of chemokine receptors or adhesion factors, or direct eosinophil apoptosis induced by the type 1 interferons released during the acute infection. In one study, among 85 fatal cases of COVID-19, 81% of the patients had absolute eosinophil counts below the normal range. That is, absolute eosinophil count less than 0.0 10 to the power of 9 cells per liter at the time of admission. Lymphopenia has also been a common finding in these patients with COVID-19 and correlated positively with the eosinophil counts. Notably, eosinophil levels improved in all the patients before discharge, suggesting that resolution of eosinopenia may be an indicator of improving clinical status. Coming to the conclusion of our study, eosinopenia is present in nearly 75% of the COVID-19 RT-PCR positive patients in the study. As 38 out of the 40 ICU admissions had zero eosinophils, and only 2 patients had 1% eosinophils, and patients with eosinopenia are having high CRP values and high CT-CVRT scores compared to the patients with normal eosinophil counts, we can conclude that eosinopenia is probably associated with higher severity of the disease. About 45% of the patients who were eosinopenic on admission had normal eosinophil counts at the time of discharge, and the remaining 55% patients continue to be eosinopenic, which signifies that we may probably use eosinopenia as a prognostic marker in the COVID-19 infection. Thank you.